Hey guys, Luis Moreno here with Simply Health Insurance Agency. Today, I've got two guests way better looking than me, and I have Elizabeth Ford, Product Manager, I think I said it right, with Healthsherpa, and Jordyne, the Healthsherpa Girl. That's it. She is, thank you guys for being on today's recording. We're going to talk today ACA renewals. We are in the early stages of ACA open enrollment, which means we're November the 7th today. We're just barely at the tip of the start of ACA open enrollment. Renewals are going to go to January the 15th. I do have a lot of agents asking, all right, when I renew people, this is the first question we're going to dive into, is if I do a renewal right now, when do they start? So you need to know that if you renew now, all the way up to December the 15th, your client will get a 1/1/2024 effective date. On December the 16th, you will have another month, all the way up to January the 15th to enroll, and those individuals will get a February 1, 2024 effective date. So be aware of that. But now what I'm going to do, and before I do this, guys, I need for you to like, comment on my video, and then please subscribe to my channel. But I'm going to ask both Elizabeth and Jordyne to talk about best practices for renewals. Guys, take it away. It's all yours.
Thanks, Luis.
Yes, thank you.
All right, can you see my screen okay?
Oh yeah, we've got your screen.
Great. Okay, so I'm logged into our staging environment right now, which is our test environment. So this is all fake client data. There's a couple of things that we'll cover today for renewals, and Elizabeth, feel free to chime in if there's anything that I miss. One of the things that I get asked most frequently, especially leading up to open enrollment and right now, is how should I manage my renewals? Should I let them passively renew or auto renew? And I always share that the best way to handle your book of business and retain that book of business is by actively renewing your clients. So that starts with doing outreach early in the year, making sure that you're checking in with your clients, maintaining a relationship. I know Louise has an amazing CRM that has some great automations in it that you can leverage. And then when you come into Healthsherpa, you've got some great renewal tools that should help save you time and really make sure that you help actively renew all of your clients. So the first one we'll talk about is our bulk renewal email. So here I'm on the client section of my Healthsherpa account. I can select all clients if I'd like to. My advice would be this will be the fastest way to do this. You can also scroll down and change the number of clients that are displayed on the bottom if you'd like to show more. So I've got 50 selected here. And then I can select renewal email. And you can see here that the system will know which clients can receive this email and would be eligible for that renewal. You can customize the subject line. You can customize the text that's displayed. And you also have the ability to remove this renewal link. And you might wonder, why would I want to do that? I want my clients to just go in there and do it themselves. Well, we were chatting about this earlier, and every single year, carrier rates change, networks change, things change in your markets. And so it's really important that you ensure that your client is still enrolled in the best plan for their needs. So while you have the ability to include the renew online, I know a lot of agents that will say, hey, please give me a call and let's schedule an appointment. Come into the office and let's renew your plan. So just know that you've got some flexibility in here for what you have the text display. You can change the reply to email if you'd like to. You can also send yourself a test email. And you can also send a copy if you'd like to receive copies of all of these emails.
Beautiful. Jordyne, I want to comment on two things. Number one, on do I want my clients to auto renew and renew? As you build your book of business, there's going to be clients who change their phone numbers and don't respond to emails. You will have a good portion of your clients auto renew. But the ones that you can get a hold of, guys, you want to talk to these clients. Okay, it is important. I did a renewal today I did 8 renewals. That's kind of why I got lost track of time earlier. But here's the deal. Every single one of them got a letter. Okay, and I kind of blacked out the information here. This is a net letter one of my clients got that just brought in. And the guy came in and says, hey, according to this letter, my rate's going to jump up to $253. And the guy's like, I can't afford that. Like, let me take a look. Let me see what's going on. I went in there. We updated the income. We did a few things. I submitted it within minutes. His premium, instead of being $253, which what the letter said, was $57. He's like, beautiful. I got no problem with paying $57. Let's rock and roll. So that goes to the question of, do I just let them auto renew or should I work them? Guys, you have to work your book. Also, it's going to give you another opportunity to cross-sell. Okay, number one, you're showing your value. Number two, you can talk to that client and tell them, look, be aware, do not go out in social media and be clicking on all these links for all these free things that don't exist. Somebody's going to steal you from me. So make sure you don't do that. That's the second thing you can do. And then number three, you now have the opportunity to cross-sell. You guys should know that the majority of these plans do not have dental and vision. If they do, they may only have a halfway decent dental, very little vision, pediatric, 18 and under. Okay, so you definitely want to cross-sell the dental and vision, and maybe even cross-sell indemnity plans. So there's a lot of good reasons as to why you all definitely want to handle your renewals. You want to take an active role. Number two, Jordan, if an agent, like for me, and I need to do this. So when I started this, I had my email. I had a email, which is an older email that still works, but I put my cell number. If I want to change the information here under the Renew Your Plan Online Now button where it says Agent Test, Healthsherpa, the 802 number, how can an agent change that?
Yeah, that's a great question. So if we X out of here, if we go to our marketing tab, I get asked this question all the time. Hey, clients are calling my cell phone and I want them to call the office number instead. It's all done in this URL, or excuse me, the marketing section. So here we'd go into the branding tab, and here's where you would update your phone number.
Beautiful. Can you update your email somewhere here?
So your email is done in the settings section, and that can be done here. Okay, so you would just update the email, and then you do have to click this update button, and you'll see a green success icon appear.
Okay. All right. There you go, guys. So emails probably won't change very much, but phone numbers do. New agents always use your cell, but as you build your book, you're like, oh my God, I've been afraid to send this renewal email because every time I do, my phone blows up. I got to go to a new one. I don't have another $1,000 to blow on a new phone. So I now have one main office number that goes through all three of my staff. And so I definitely need to get that renewal number changed. Thank you.
Another thing to note is that if you do send out the renewal email and you opt to include that link, if the client does the renewal themselves, your NPN is automatically applied to that renewal. So just make sure that before you start doing any renewals, whether you're processing them or sending out that bulk renewal email, just go into your platform and update your carrier settings. If you are participating in the referral program, you'll want to make sure that you have which carriers you'd like to refer and which ones you're appointed. We do not do this for you. So if you have not done this, make sure that you go in there and update that.
Great.
All right, so we'll talk about a couple of ways that you can renew your clients. So the first thing I'll point out is we can look at a renewal status. So if we wanted to filter this by not renewed, we can select that and our book of business down below will refresh. You can see here in the client table, if I click renew, this will drop us right into the renewal flow. So our team has done a really nice job updating the renewals year over year and really working on making renewals faster. And Elizabeth, check me on this, but I think last year our average renewal took about 4 minutes and the average application took 7.5 minutes. So we're always looking for ways to make these renewals as quick as possible. I know the best case scenario would be like a one-click renewal, but we're not allowed to do that. So we'll try to optimize it to the best of our ability. So in this example—
and let me chime in on that, Jordan. So when you hit the start renewal, guys, it's going to bring over the data from the current policy. It's going to bring in their income, their household members. Literally, you're going to go through the steps here. And then when you hit add to cart and you go next, are we going to go through an actual renewal so we can show agents?
Yeah, so I'll show a couple of examples here. And there's a few different ways that you can get into a renewal. So I'll make sure that we cover all of those today as well.
Okay, perfect.
So here we had pulled in everything from the previous application from the clients within my Healthsherpa account. If the plan is available or the current plan, it will be flagged here in the dashboard. So I just picked a random example here and it's not coming up, but let's say we want to just pick this United Healthcare plan. We click add to cart and start application. For a renewal, you'll go through the normal attestations, and then this is what we call our turbo renew. So you can see here that this screen is quite a bit different than what you expect on Healthsherpa. What we've done is we bucket every section that we are able to together so that it's a quick review with your client, and you'll only need to update any sections that have changed. There are a couple of sections of the application, like the income, where you'll have to go fully through that and make sure that everything looks correct. But again, this turbo renew should essentially cut the average renewal time down to 4 minutes.
Yep. All this data, guys, is coming from the previous application. So it's just confirm, confirm, confirm. On the income, guys, here's a catch. In fact, you know what? I will give you the catch when we get to the income section. Go ahead, Jordan.
So I can click through a couple of pages of this to show you. I'm hoping my staging environment cooperates with us today. It was going a little slow for me earlier.
Yeah, I think a lot of renewals.
Right, so here's another page. This is the household. So again, if nothing has changed for the family, it should really make it very simple for you to go through your renewal. Again, all the same questions that everybody is familiar with here.
And let's talk about one thing here. Can you go right back?
Oops.
Because I am omitting this, and I don't think it's a problem. At least I don't think. But right there, guys, the last 3 questions. You know, what is a spouse, pitch, sex assigned at birth? How do they identify right now? And what is their sexual orientation? Guys, I wouldn't spend a lot of time on this. What are your thoughts on that, Jordan?
We have some resources that I'd be happy to share with you. I think it's really important, depending on, you know, the clients that you're serving, that they have adequate representation. This was a requirement from CMS, and this data is really being used to ensure that everybody has equal access to healthcare and really just ensuring they have what they need. So I actually had an agent call me about this earlier today, and there's a lot of specific details to answering these questions or how you support any clients that might fall into unique circumstances. So Louise, I'll share those with you, and then we could either do another call on that, or we could share those with your network as well.
And guys, what I'll do is when I get them from Jordan, I will put them in the description down below, and that way you can pull them up and read it. I will tell you this, that I did have a client where I made an error, and instead of choosing, I chose the wrong gender. I mean, it was literally not that I couldn't tell what they were. I just clicked on the wrong button, and they had a problem at claims. Okay, because they thought it was a male and the policy was under a female. And yeah, it's make sure that you are collecting the data. So is this just for record keeping, Jordan, that you can think of these 3 questions? I mean, or is it just like statistics they're trying to come up with?
Elizabeth might have a little bit more context on this. Go ahead.
Yeah, this information is really only shared with CMS. It doesn't go to the carriers or anything. It's kind of like Jordan said, it's for their own internal use and just kind of making sure they have coverage for folks. And like I said, these are all optional. We're encouraged to fill them out so CMS has the information, but this is not shared, or it shouldn't be shared with the carriers for any change in coverage. And we can definitely send more information since these are new questions to the application this year.
Yes. Okay. Sounds good.
Great question. So again, I'm just kind of quickly clicking through here. So here you can see the income section already has our income entered.
So let me go back to the income, guys. So let me tell you all, if you all used minimum income numbers last year, those minimum income numbers have changed in 2024. So last year we were able to use, let's see here, minimum income for a household of 1 last year was $13,590. So if that number comes over here as 13, instead of 50,000, if it shows 13,900, they are not going to get any subsidies and they're not going to get CSRs. You're going to be wondering, why is my client paying the full premium? Where did I go wrong? So make sure that you're updating the income. For a household of one, the income for 2024 went from 13,000 and change to 14,580. So you need to have a conversation with your insured. Look, the minimum income numbers changed. They're a little bit higher this year. Are you going to be able to have the $14,580 for 2024? They say yes, enter the data and proceed. But know that that is causing agents to not get to, if you use that minimum income from 2023, you're going to see no subsidies and no CSRs, and they're going to pay full price. The quote and what you finish off are going to be completely different.
Yeah, that's a great point, Luis. And something that comes up every single year is that the government FPL chart changes year over year. So for 2024, we're looking at 2023 data, and it's a different chart for Medicaid eligibility as well. So we'll make sure to share the 2023 chart with you if you don't have it, and you can drop that down in the
It's my screensaver, girl. I can't live without it. Okay. So no, it's not my screensaver, but it almost acts it because it's always up. And here's what I'll do for you guys. I will share a link to that down below also. I'll put it on there so you all have it because it is important. Now, if you do screw up, if you don't update the address, if you don't update the income and you notice that you're paying full price with no CSRs and you're like, oh, what can I do? How can they go back and fix that?
They would just open up the current application, especially during open enrollment, just open it back up and report a change, and the change will submit the new plan. So it may cause a change in eligibility, but really simple during open enrollment to be able to go in and fix that.
Exactly. Yeah. Just report a live change, go to the income section, fix it, and proceed. One more thing, another big point here. Okay, we'll go back one more if you don't mind, Jordan. This does cause some issues too. Right, a little bit higher. No, you're good. Go forward.
Sorry, I'm going too fast.
Right here. Okay, scroll down. Additional question section. All right, guys, look, there's a lot of people whose kids had Medicaid and they got kicked off due to the Medicaid unwinding. Sometimes the system will think that a child qualifies for Medicaid and it won't insure them. If they have a denial, guys, you have to go here. Okay, now these are adults, but let's just say that Brad Pitt or the spouse, there it is, Child Pitt. Can you click? In fact, you wouldn't do it on the first one. You would do it on the bottom one, I think. Child Pitt, correct. You would click on child and then enter the address of when they received that rejection letter. Okay, and now when you do that, what it will do is it will now add the kid back into the application so they can get insured.
I'm going to remove it for this example,
yep,
so our example doesn't get stuck. But yeah, great point on that as well. So as you can see, a few of these screens you do still have to click through, but this is very simple for us to get to the finalized page here. So again,
I got another one. Caught it, Jordan. Right back. We were going to discuss this earlier too on SCPs. Go right back. If your client still needs, we're doing this in early November, guys. But if for some reason you have a special election, for example, like the one right here, will anyone lose qualifying coverage before this date? Well, if you choose Brad and his wife, you can put a date and get them an effective date of 12/1. This is where you would do it.
That is correct. And I'll show everybody where they can go to get the 2023 application as well. Or the 2023 plans.
Correct.
So here we're on the finalized page, pretty quick to get through our renewal. You'll want to make sure that everything looks correct. These are the same agreements that everybody's used to. And then here we would pull the eligibility results and you would be able to submit the renewal. So I am going to just shift back over to our test environment here to just show you a couple of other things. So as you are processing renewals, there's a few things to be aware of. If your client does passively or auto renew, CMS does not allow us to pre-populate their data in your Healthsherpa dashboard. So you have to manually look them up. So if you are using a CRM, I always advise you should have a working list of all of your members to make sure that going into next year, you've added all of them to Healthsherpa and that none of your clients fall off of your books. So you would have to come in here and you would have to type in their name. Let's see if I can find an example. And then you would search the marketplace. Now, if they had auto renewed, you could click add to clients. If they were due for a renewal, you would have the ability to click a button here that says plan year 2024. And that is how you can start the renewal. So that's a good example of, let's say you get a new client and they previously had marketplace coverage. You don't need to do an entirely new application for them. You do the search marketplace, it'll pull in their record for you. You'll update anything that's changed. If they are a new to you client, I would strongly suggest making sure that you go through everything in fine detail, make sure that the previous agent that helped them didn't enter anything incorrectly, and then you can pick their plan for 2024.
And I do have a question. Can you go to the other screen and see if your eligibility went through? Okay,
Yes.
do me a favor. Let's go down. You got to hit the download in order to go to review plan, but I want to show something new that has come up. Okay, let's go down all the way to the consent button at the bottom. So guys, be aware, 2024, in fact, even in late 2023, we should be getting consent to enrolls, okay? Whether you capture them by email, by text, by voice, by wet signatures, or by digital signatures, you must be getting consent forms. Now, I get them. In fact, I got all mine. They were here. They signed. I scanned them into my management system. And then I checked off, I already have proof in my own records. But what happens when they upload this consent to Healthsherpa?
So they can do it right here, click upload, and then they can access it from the client detail page. So let's say we said I have this in my own records or do this later, and we click enroll. Now this is being submitted, and let me just show you where you would go to either access that or upload it. So here, clients, click on the name of the client, and then on this client detail page, we can scroll all the way to the bottom of this page, and this one tends to load a little slowly in staging, but you can see here the consent record. So you can upload it here. If we had uploaded something right now, we would be able to download it from here.
Gotcha. So whatever practice you use, guys, if you don't have a management system where you store your client's data, then you've either put it into some folder system that you make, or you can put them in here and Healthsherpa can retain them for you.
And the last thing that I'd like to share today is if you are working with a client, whether it's new or existing, that does qualify for a December 1st SEP. We get asked this all the time. Hey, how do I do a plan year 2023 application when the 2024 rates are live? So I started from the quote, when you scroll down to the plan results, there's a drop down here. So sometimes this gets hidden. You would just want to change this to 2023.
There we go.
And then you would add it to the cart and you can follow the normal search the marketplace and then process that SEP application utilizing the qualifying life event of losing coverage or whatever their qualifying life event was.
Which all this will work for the month of November, but once you're in December, then this is useless. Focus on 2024. Awesome. Guys, you got some great tips on renewals there. Make sure you're doing it right. Make sure that if you're searching for clients, that you've captured that consent prior to the search, prior to the renewal. Make sure you're doing things right. We don't know what the consequences are going to be for not having it, but if you want to do this long-term, guys, you got to do it right. Okay. Another thing for long-term, sticky business, talk to your clients. Be one of those agents that talks to them, that doesn't passively renew. You actively renew them. You've captured some data, you've updated some data, and you've presented the best possible plan for them based on their doctors, based on their medications. That type of business, guys, sticks on the books. There's a lot of agents that complain. I wrote them and they left me. Well, did you create a relationship with them? There's no relationship. Okay, you didn't do your job. You just captured them. You never talked to them. Who knows how you got them? But if you want to have sticky business, long-term renewals, what you need to do is you need to make sure you create that relationship with a client and then let them know, hey, I'm your agent. Okay, I'm the guy that's going to be taking care of you. I'm the girl that's going to be taking care of you. Don't go anywhere else. And you will build a huge book, and you will be able to retain, and you will be able to get those monthly commissions, which are incredible. Okay. All right, guys. Elizabeth, Jordan, thank you so much for today. Best practices, work on your renewal book and then focus on new business. Renewals are worth just as much as new business. Back in the day, they weren't, but now they are, guys. So make sure you're renewing your book. Thank you. Guys, don't forget, make sure you comment, like my video, give me that thumbs up, and please subscribe to my channel. Thank you, guys.
Thank you.